today. Well, I'm going to go look up your medications, okay? If you need me, you can call me on the call bell, okay? I can't reach that. I'm in first class. I shouldn't even have to lift a finger. Just use your arm muscles. I'll see you later. Good morning, Metro 7, Smarta speaking. How can I help you?
This is Tiffany calling from the lab. I wanted to talk to the nurse who has the patient dazed and confused.
This is her speaking. How can I help you?
Hi, Marta. Like I said, this is Tiffany, and your patient dazed actually has a critical value. She has a potassium level of 5.5.
Hi. Thank you for calling. Bye.
Why did she just hang up without reporting that back to me?
I think that's a low value. I better go give her a supplement.
Hi, this is Resource Mentor 7. How can I help you?
Hey, this is Tiffany from the lab calling. I actually just talked to a nurse by the name of Marta. She was taking care of a patient named Dazed and Confused. And unfortunately, when I was just talking to her, she never reported back what I told her. Is there any way you can check to see if this was noted in the chart?
Yeah, sure. What was the patient's name again?
Dazed and Confused.
Okay, I have her chart. What was the lab value?
Dazed actually had a potassium level of 5.5.
Okay, so I have dazed and confused, potassium of 5.5. Okay, I just noted it. Thank you very much. Bye.
I was confused. Oh, you're back? Yes, I am. The lab just called and your potassium was low, so you need some potassium supplement.
Why are you going to give me potassium? I'm on an airplane, a flight. I could at least get a bag of peanuts.
I was confused. You're in a hospital. You're not in an airplane.
I don't believe you. I guess this is all I'm going to get. Where is that flight attendant? I need to talk to her. This is the worst service I've ever gotten on a flight. If I can just get to this call button. Oh my god! This is the worst flight I've ever been on. I've never ended up in the aisle. Help! This is terrible. This is the worst flight I've ever been on.
I'm confused. Why are you on the floor?
I don't know. That stupid flight attendant. I was trying to call her and get more potassium, and I ended up here.
Oh, well, come on. Let's get you up. Marta, this is the person I'm looking for. What's wrong? Well, for starters, I got a call from the lab earlier. You didn't repeat a critical value back to them, and I have to go back and chart it. You did not even put it in the chart. I just went in your patient's room. She had no ID band on. Her call bell was out of reach, sitting on the dresser. Her side rolls were down. The bed was in the highest position, and there was no bed alarm. She was obviously confused. Welcome to the Joint Commission Patient Safety 101. This would be considered a sentinel event with serious consequences. Remember to always use 2 patient identifiers when giving a med. Remember to report back critical lab values to the lab when receiving a result. And always remember to reduce the risk of harm resulting from falls. Thank you.
Bone crusher is my name, and pain is my game. If you want to play in my house, you better play by the Joint Commission rules.
Yes, doctor? Yeah. Yeah, I could do that. All right. Ow!
V-O-R-B. Verbal orders read back. You touch the pan, you wash your hands. You know that. Face sheets belong in the shredder, not in the trash can, Mike.
Vincent, that alarm has been bugging me all day long. Could you please turn it off?
Woo! Woo! Here comes the pain train. Get ready for the pain. Alarms must be activated and sufficiently audible with respect to unit noise and distance. That ain't nothing new.
I'm sorry, Bone Crusher. It'll never happen again.
Let's see. Heparin, Levaquin, dopamine, Diprovan. Oh man, we're out of Bumix. Oh well, I'll just give Lasix.
You know the 5 rights. Right drug, right dose, right time, right route, right patient. Every time.
I'm here to draw your blood. Hey! Hey, what are you doing?
Oh, you didn't respect the patient's privacy. You didn't check 2 identifiers. You didn't wear your gloves, and you didn't introduce yourself. If you're going to play here, you better bring your A game. Where's your name tag, Oscar?
Yes, good morning. This is Steve from the laboratory. I have a critical value of Mr. Lopez. His potassium is 8.2.
Critical value? Yeah. Okay. Sure, that would be great. After I get out of here, we'll go get a bite to eat and then to the movies? Yeah, maybe we can.
You're about to get a hurting, and that's for certain. You need a physician's response on a critical value within 30 minutes, and you haven't even called them yet. Delay a game, 5-yard penalty.
All right, Miss Padilla, x-rays are all done. They'll be here to check you up in a minute.
Hey, get back here. You call that fall precautions? The bed is up, the rails are down. Give me 100 up downs right now.
1, 2, 3, 98,
Come on.
99, 100.
Attention please, rapid response team, please report to room 216, bed 2.
You call that a rapid response? I know you're tired. I know you're being beat up out there. But healthcare is no place for wimps. Now let's go out there and let's save a life. Go, go, go! I just want my patients cared for in a safe and respectful manner. Is that too much to ask for? Sally, great call on that surgical timeout. I like the way you marked the surgical site.